Welcome to DocPod. Hear Health.
Dr. Whyte, wanted to welcome you to the show and appreciate having you. And maybe just kind of a brief overview of what you're doing now at WebMD, some of the things that you've spearheaded as far as innovation and how you're driving the business.
You know, a couple things. We're very focused on how do we address misinformation. You know, during the COVID pandemic was really one of the times where we really showed the trust that people have in our brand and the authenticity of the information that we present. You know, every piece of our content is reviewed by a board certified expert. We show who that person is. You can hyperlink. We show the date that information was posted. And now a big challenge is, you know, any influencer to some degree can be a medical expert. So how do we help folks get the best information when they search? You know, the other elements is, you know, how do we promote more thought leadership at WebMD? How do we handle these important topics such as artificial intelligence and how that's potentially reshaping the healthcare workforce and the healthcare workflow? And then the use of wearables and digital tools. Those aren't the things that people search the most online. They typically search about a disease state, but these are still important issues that people want to know about. So that's where I've been spending a lot of my time.
Perfect. And you mentioned AI and wearables. We chatted briefly just before the show, but previous position in my career after I transferred from medical recruiting and leadership in physician recruitment was into IT and technical recruiting and management therein. And one of my clients at the time was with Magic Leap, and Magic Leap being one of the pioneers of wearable technology and AI and ML driven technology as well. One of those implications, which I was the most excited about at the time, was potentially being able to port in to a residency program or a medical school anywhere in the world from a Harvard Medical School or a UPenn or some of the places where you have attended and been and be able to teach accordingly. So when you talk about wearables, what specifically are you seeing as far as innovations, applications now? Because that was 10 years ago for me.
Yeah. And I'll tell you, WebMD also owns Medscape, which is the physician education portal and pharmacist portfolio in terms of how they get information. We're the world's largest provider of continuing education for health professionals. So we're very interested in medical education. In terms of wearables, when you think about it, we basically all have supercomputers on our wrists or on our fingers. If you're wearing some of the ring devices, there's even going to be a necklace that's going to be smart in terms of the technology. But what I'm most excited about is here it's collecting this biometric data about you that's continuous over time. Now, we still haven't sorted out blood pressure in wearables, but am I most interested in your heart rate and your blood pressure the one or two times you come to the doctor's office a year, or maybe every other year, or what you're doing on a continuous basis at home in your normal activities? Am I able to use a smart device to check whether you have sleep apnea? That's what folks are currently working on now, so you don't have to go to a lab, which never really made sense, and told to sleep, and then I measure how well you do. And even just, you know, other tools that wearables are allowing us to do at home. And they may not be medically grade. They're going to get better. But to be able to say we're about patient-centered care, patient-driven care, and we can bring more care to the home, and we learned that during the pandemic that we can do that. That's what I think is really exciting. And those are conversations that we didn't have just a few years ago.
Well, and I have to think also with the wearable technology and having all of that data from every single day that you're wearing it at home, at work, in exercise, wherever you may be, that's invaluable to physicians as far as making an analysis, diagnosis, prescription for whatever that may be. And I feel like it can only get better. And you're probably seeing a lot more of that getting better than I am just in the field that you're in, industry and company. So tell me what kind of impact that's made or that you've seen made maybe in patient care in general, even preventative care.
Yeah. I'd say we're still not where we need to be honest. We're still talking about interoperability. I've been a physician for 25 years. We've been talking about that over the 25 years. Part of the challenge is that information that you're collecting on your wearable tools, or even if you get a home lab test, you do it, when it's convenient for you, it's not always feeding in to the medical record in a way that the physician needs it to best interpret it and utilize it. And part of the challenge is also FDA regulation. And I say that having been a former regulator. In terms of medical devices, if you make a diagnosis, which is really what we want these tools to do, maybe a pre-diagnosis. Tell me you have pre-diabetes. Tell me, you have hypertension. That then it requires more testing. And everyone's not Apple that can spend millions of dollars doing testing to determine whether or not, your wearable can tell you whether or not you have atrial fibrillation. So we need to improve the way we think about these regulatory pathways. So I wish I could say, to be honest, that we're in a better place. What I think it does, though, still, is it helps empower consumers with more information about themselves that they can act upon. I mean, honestly, I utilize one primarily because many of us think we walk a lot of steps during the day, but we don't. The average person probably is around 3 or 4,000. And we're telling people 10,000, maybe it's really 8,000. But if you know you're 3,000 or 4,000, then you know what you need to do during the day to do better. So they really can empower people if they're used effectively.
No, absolutely. And I'd say that contradicts the cliche of ignorance is bliss, right? Because
Yeah.
your bliss is not going to last very long if and when you don't know what you are and are not doing for cardiovascular health and blood sugar regulation and anything like that. That
Right.
is now a little bit more fingertip available due to some of these technologies.
Or continuous glucose monitors, right? We can get a
Right.
CGM now over the counter, and I can understand how my body's responding to certain type of foods. We all have these idiosyncratic reactions to certain types of food. And if I can see how exercise impacts my blood sugar, if I can see how eating ice cream or a bagel does it versus, seafood, that might change my behavior. So I think it's important information. But I'll tell you where I think the problem is. All too often, we only cover it for those that are already requiring insulin. I would say we should be doing it for anyone who is concerned about prediabetes, right? So I can change behavior then and have a greater impact rather than later on when they're already requiring medications or they develop insulin resistance.
Absolutely. And when you say that, touches a bit of a personal note. Both of my parents are pre-diabetic and have had to change diet
Yeah.
and not necessarily lifestyle because they're both very, very healthy. But even so, and they don't use any kind of wearable technology. That would be something that I'm now going to get them whatever it is that they
Mhm.
need to be able to help. But it's really just been a change in diet for them. And so with the use of these technologies, wearable AI or otherwise, the information being really right in front of you at any
Yeah.
given point where you can change at a moment's notice,
Mhm.
I think is life-saving.
Absolutely. We like to say information is power. Again, it has to be the right information, but everyone
Mhm.
wants personalized medicine, right? You want the right medication for you. Well, now we have more tools and technologies to start to truly get to that process. I don't think we're completely there yet, but we need to invest in these technologies. We need to understand how best to implement them. We need to empower consumers, but we also need to democratize it too, because we don't want people that can afford smartwatches to be the only ones that can have it to benefit from that technology. So there's still a lot we need to do, but it's really an exciting time how we think
No,
about health.
I would tend to agree with you, and mostly because people are thinking about health, or more people are that maybe otherwise would not have,
Mhm.
just because of the ease of use and the information that is so
Yeah.
readily available to us on Google and or
Mhm.
Apple Watch or anything else that gives that to you in real time. Again, and I have to think that maybe over the next 10 years, hopefully not that long, it will be a household item where it's standard. And, your information is up. Hey, by the way, you need to eat, a sweet tart, or you need to not eat 2 or 4 bagels today. And so on that note, I'm curious, with AI being the bleeding edge of technology right now, and as it's being inserted into healthcare and medicine in multiple different facets with EMR and charting and documentation, do you see that rearing its head into making diagnoses and kind of eliminating some of the time that it may take for that? I know there's always going to be a personal touch there. Of course, there has to be. But how do you see that maybe operational efficiency in healthcare?
I love that question, because I would argue we haven't even scratched the surface of the power of AI. And I still see patients, and when I talk to my clinical colleagues, they get excited about AI in terms of ambient listening, the scribe service. It's going to, prepare a note for me. What I get excited about is that ability to help with diagnosis. And if you think about it, a lot of medicine is about recognizing patterns, the patterns of symptoms, the patterns of impact of medications. Supercomputers can recognize patterns much more effectively than we can. And if we take the idea that there's 800,000 roughly preventable medical errors that occur every year, 40% of them are in diagnosis. And these are not uncommon things. They're like pneumonia, stroke, pulmonary embolism, sepsis. If I can use AI to help get that accurate diagnosis earlier, that's where the real value is. If I can have everyone who has a cancer diagnosis receive a second opinion powered by AI, that's going to be the real value of AI, not in terms of scheduling. I could argue even note taking. Those are important, but that's workflow, which does have value. But the importance is this issue of diagnosis. And I'll tell you, what gets me a little annoyed at times is we have to admit physicians make errors, right? We're all humans. But when we're evaluating these technologies, it's like we're holding them to a different standard. We're holding them to 100%. They have to be right 100% of the time. We're not right 100% of the time. And I look at the field of radiology, where that's a lot of looking at patterns. The human eye can't do it as well. And we see using an AI tool with a radiologist, and maybe if we call it augmented intelligence instead of artificial intelligence, we see that there's greater detection of malignancies. And if that's the case, we could argue there is a moral imperative to use AI when we know that it's going to improve diagnostic accuracy. So we are aligned.
Yes, right. And those statistics are, I did not know. I assumed something to that effect and that it did exist, but to that level, I had no clue. And I'm certain the listening audience doesn't either. So that's incredibly important. Let me ask you this. I was in a conference that was the CEO of Akamai Technologies was giving a speech just on technology innovations. And this was years and years ago, but something that stood out to me. He mentioned, the current iteration of, and it was a specific network that he was talking about. He goes, we have number 10. This is number 2. We've already had number 10 produced. It's like the Marios when they used to do it. We've got number 50 and only 3 is out. So do you see that with AI as we're holding this back because either the public can't handle it or even the technology that it would integrate with can't handle that? Are we already more advanced than we see? And what does that look like when we get those technologies or that implemented?
I think it's going to continue to get better. And we're seeing amazing advances, sometimes in a period of months rather than years. But I think part of the challenge is when you look at, say, just generative AI, only about 35% of the public at this point in time has ever tried ChatGPT or Gemini or Dolly or any of those tools, whichever it is. I think more and more people have to utilize them, have to get experience, become less fearful of them, understand what works, what doesn't, how do we refine them. We can't just let the technology experts and lovers do that. So that's where I think there's a little bit of a holdback, right? And even when I look in the field of healthcare and medicine, a lot of AI tools and digital tools fail because they don't understand workflow. They don't
Mm,
understand the clinical experience. And I'm fortunate because I still see patients because then I understand how that works. But that's because physicians are busy, they're jaded sometimes, they're burnt out. How do we engage with them? How do we engage with consumers to understand what they want? Sometimes the reason why consumers are so interested in these tools is not just because they want to empower themselves, but in some areas of the country, it can take 50, 60 days to get an appointment. And
mhm.
when you have a concern about a cough or a skin rash or something, you don't want to wait 2 months before you can get seen. So, lots of issues around people's comfort with it, utilizing it. And we don't want technology to get too far ahead of where we're at.
Understood. And I think maybe on that note, another question I had is not talking about the patient or general population, but
Mhm.
in the medical community, as physicians, do you think that maybe there are not as many advances in AI just because people are a little hesitant? Is there like an old guard that's saying, "No, I don't think so. That's not for me. I'm not going to touch that." While the fresh out of residency person, they're getting introduced to that
Yeah.
as a younger generation, and there's well, then the people with the most experience are potentially
Mhm.
not utilizing that due to fear. Or how
I
do you
think
see
there
that?
are some generational issues. And I also think it's because we've heard a lot of things that were going to help improve, the healthcare system and our workflow that didn't pan out. Right. So that's why I said
Mm,
a lot of times folks are jaded. I've heard it all before, where the attitude typically is, I'll wait. I'll wait to see how it gets better rather than being engaged now and being a partner in figuring out how to best utilize these tools. That's where I think part of the challenge is. And you're so busy, it's hard sometimes to innovate when you're just trying to get your work done and get
mm,
out, at a reasonable hour. So we have to figure that out. And the other thing I want to point out is, where are the shared expectations? And that's sometimes where I feel there's a challenge. So even when you look at some of the tools for ambient listening, the scribe services, sometimes when these companies will talk to a healthcare system, they'll say to the healthcare system, we'll help your doctors see more patients each
mhm.
day, right? Because they're going to help with the note. Is that what the doctors want? Do the doctors want to see more patients? No, they want to be able to spend less time charting at the end of the day when you're often trying to, get
Right.
home. So there aren't always shared expectations of what people are looking for. And I think in some ways it's kind of how it was years ago too, when they want to create guidelines at a hospital or management of sepsis. They take the experts, right, who aren't seeing patients as much, and then they
Mhm.
implement a process that then the worker bees, in a way, have to utilize. But they never talk to the folks who are actually on the ground day to day. And that's where I think there's a disconnect sometimes too.
No, that's interesting. I'm curious, as you mentioned before, and as I know in general, at
Mhm.
WebMD, one of the main drivers or initiatives is medical education, of course,
Mhm.
not necessarily just for the patient population, but also for healthcare professionals.
Sure.
So, um, how are you working to do just that? Maybe especially in this field,
Yeah.
where
Yeah.
it's adoption, partnership, things like that.
And we're doing a lot of studying and research on it. We do have an ambient listening to scribe service that people can sign up for at Medscape.
Mhm.
And we're also experimenting with the idea, just given the amount of new information that comes out, every year, especially at big national meetings. Can we utilize AI to help, you know, create an abstract for some of the latest findings or help interpret the latest findings from a study to help give more guidance to healthcare professionals? I mean, our position is everything at the beginning, at the end is still reviewed by a human, but can we utilize generative AI to help perhaps with some, recent research findings or research studies? Can we help in terms of that workflow issue, in terms of generating that note? So we are starting to think about how do we best utilize it? If you're searching for information, how can we help generate content that is going to be most helpful to you? And this is an exciting field. I think it's going to be very different even a year from now in terms of what we're talking
Mhm.
about than we are today.
I think so as well. I'm curious as you talked about some of the research, maybe implications of AI. So I'm curious, as maybe if you're I don't know, a research scientist as a physician as well,
Hmm.
and you're looking for a cure for any kind of cancer, but cancer in general, or you're doing the research on treatment for that.
Yeah.
Um, do you think that um, I mean, I have to think that over the next 3 or 4 years, as AI continues to grow and get better and smarter and faster, that we could see some cures for things that we haven't thought about having for 20 years, maybe in two.
Yeah. Absolutely. And this is this whole issue of AI helping in drug repurposing, right? A lot of clinical
Mhm.
trials fail. And we just gave a WebMD Health Hero Award to a physician who worked on Castleman's disease and really trying to help find a drug for that. But now we can think about how does AI help in terms of finding, new indications for drugs or finding new molecular entities. Um, in a way that doesn't take 10 or 20 years to bring a drug to market? How do we use this concept of a digital twin perhaps to make it easier to understand how do we personalize treatment for you? So I still think this is going to be in this process, several years in terms of where we get to where we really want to be. But it is exciting. Think about how do we use AI to perhaps find, new therapeutic options.
And as a former regulator,
Mhm.
with the FDA, how do you see the adoption and just
Mhm.
the maybe accepting of AI produced new drug combinations,
Yeah.
prescriptions for treatments, things like that. And of course, without, I don't know, stepping on toes or anything like that. I don't know
Mhm.
how loaded of a question that
No,
is,
I
but
love that. I love that because I've talked about that. That's why I said it's going to be several years because
mhm,
I do think from a regulatory process, which tends to be conservative, both in thought as well as trial design, they may have some challenges
mhm,
about using AI for that. So, but now's
right.
the time to start to be thinking about that. But I do think because there has to be transparency in terms of how information was obtained. I think that could be a little hiccup along the way that will need to be addressed and hopefully sooner rather
Mhm.
than later.
Yeah, I hope so very much. So, if you can touch on the is this normal? The first books that you had that came out,
Yeah.
I'm curious about it because I read
Mhm.
portions of it, or at least portions of the
Mhm.
summary, and I did a previous episode with the owner of Medical Anti-Aging, which
Mm.
is
Mhm.
peptides, hormone therapy,
Sure.
and focused on women's health, but then men's health as well, and a great conversation about
Mhm.
a lot of those things that happen in your 40s and 50s,
Mhm.
perimenopause into menopause, and so on and so forth. So, um, some of the things that your book touches on, if you could go over
Mhm.
just briefly and talk about that again. As a middle-aged man, I'm selfish, so
Yeah.
I'm asking some of these questions for
Yeah,
personal
sure.
reasons.
Yeah, you've done your homework. So it was a book I wrote actually now over 10 years ago called Is This Normal? The Essential Guide to Middle Age and Beyond. And I wrote that because I found that, a lot of patients don't understand what's a normal part of aging and then what's a symptom that could be a harbinger, a sign of more serious disease. So for instance,
Mm,
sometimes a lot of patients would say, "Oh, as I get older, I'm just going to sleep more and need more sleep because that's just a normal part of aging." When the reality is, it isn't a normal part of aging. And if you're having poor sleep, that could be a sign of more serious disease. It could be a sign of depression. It could be a sign of thyroid disease. And really to help people understand when should you, seek medical attention more urgently versus not. Hair loss in 20s and 30s for women is very different than later in life where they're going to suffer some type of hair loss in their 60s and 70s. So to understand that, this concept that back pain and joint pain is a normal part of aging, there's some degree to that. But at the same time, pain should not be accepted as a normal part of aging. So that was really to help them, understand that. A common question is as people get older, how many times is it normal to get up at night to urinate? The answer is it should be less than twice. If you're getting up more than twice a night to have to empty your bladder, you really need to be seen by a physician, perhaps even a urologist. So it's really helping people to understand their body. Even before I got to WebMD, I was interested in empowering people with information so they can have better health. And nowadays there's a lot more that people can do to empower themselves.
Well, and you've done an excellent job of that with me today. I appreciate sharing some of
Sure.
your knowledge and wisdom in the medical field and some of the innovations you're doing at WebMD and in general and seeing in the industry. So thank you very much for your time, Dr. Whyte. I appreciate it. Great having you on the show.
Yeah.